Okay, I'm Terry Emerson. I'm a specialist surgeon at North Down Specialist Referrals, and this talk is going to focus on the surgical problems that we see with brachycephalic dogs. We're going to cover the most common problems, which are the upper airway surgeries, but also salvage procedures for laryngeal collapse, and then look at surgical options for ear disease, hiatal hernias, and skin folds. Anti-inflammatories. There's certainly an argument for giving these dogs, if they're quite bad, steroids. So they will get edema of their airway quite commonly. So quite commonly it becomes quite swollen, particularly the palate and the soft tissues in and around the pharynx. So again, quite commonly we'll give a dose of dexamethasone, again IV, preferably if we can. It's more predictable, and that can really help. The other thing to mention that sometimes causes a crisis that I've seen a few times, which is worth mentioning, is these dogs that sometimes they vomit and then they go into a crisis, and I think that can happen for two reasons. In some cases, basically the vomit then obstructs the airway and starts the whole cycle. The other thing is I think sometimes the acidity of the vomit can actually set off like more or less an edema in the soft tissues. So again, I've seen a few of these bulldogs that they have a history, they were okay, they vomited for some reason, then the next minute they're going into quite a crisis. And those dogs we've seen have often got a much more edematous airway than some of the others. And I think it's possibly the acid that basically in the vomit that can just cause a big degree of edema in and reaction in the soft tissues. So doesn't change what you do, but I've seen a few bulldogs that go into crisis after vomiting. Temperature is very important. So again, if these dogs are basically hypothermic, then they're going to continue to pant, and the more they pant, the more their airway obstruction gets worse and the hotter they get. So it's quite important to try and cool these dogs down. Now, to some extent, if you can sedate them and they calm down, they will cool, but often they're going to need more than that. So again, cold towels, fans, the ice blocks, as long as you're careful that they're not sitting on them for too long and causing burns. But some sort of combination of put them on a cold floor quite often. Again, if you've got a nice cold hard floor, that can work quite well as well. But some combination of basically being aware of how high their temperature is and then also reducing their temperature as best we can. So if you get the temperature down, it will reduce their reduce the panting and reduce the symptoms. And as we said, so basically making a judgment call on how severely affected they are. If they're not, they're moderately affected, we will try those things first, and if they calm down and they're okay, that's great. The ones that are not improving or are very severe on presentation, we will, like I say, as you said, we will anaesthetise them and intubate them. And obviously at the point we do that, then we get to do the airway exam and do the diagnostics as well. And or you could consider an emergency tracheostomy, again depending how severely affected they are, whether you can get IV access to induce them, and what you think you can do on recovery. So depending what situation you're in, whether you think you're going to be able to do the airway surgery or whether you need them to be stable without the airway surgery so they can be sent on, will make your decision. But some combination of those procedures can be appropriate. So like I say, and certainly I wouldn't worry about it at all. If obviously in the short term, the quickest way to control the airway is to induce them and intubate them. But like I say, you can get a problem when they do wake up. So again, be aware of that it's, while they're intubated, they're fine. It's when you wake them up that the problem comes. And some of them will repeatedly go into crisis every time you wake them up. So it's probably appropriate to talk a little bit about tracheostomies, in that, like I say, occasionally in these bulldogs you will need to think about doing that. So it's probably a good time to talk about that.